angiotensin 2 receptor blockers, or we can say ARBs. Now, in this presentation, we're going to talk in which disease process we use these ARBs for, what is the mechanism of action, and we're going to relate and understand, depending on the mechanism of action, why we use this medication in particular disease process. Then we're going to go over the side effects and nursing consideration, contraindication, and finally we will go over how do we find out which drug is ARBs, or how do we easily recognize this drug is ARBs. So let's first start with the indication. So these drugs are mainly used in heart failure, to treat the high blood pressure. They are used in diabetes mellitus, but not to treat the diabetes. It is used to prevent the kidney damage in diabetes patient, and also in some cases it's shown to help with diabetic neuropathy as well. And it is also used instead of ACE inhibitor due to their side effects, because one of the main side effects the ACE inhibitor has is the dry cough, and it's sometimes so persistent it's not tolerable by the patient that they have to switch it to the ARBs. So one of the reasons we use this ARBs medications as well. So let's talk about the mechanism of action. So before looking into the ARBs, you should have looked at the RAA system and how it works in our body. And if you have looked at that one, here we have angiotensin 2 that's going to work in our body in these different ways, and it's going to produce defects, like it's going to increase the sympathetic system, it's going to increase the sodium and water reabsorption, excretion of potassium, and so forth. Now, this angiotensin 2 receptor blockers blocks the receptors of this angiotensin 2. So whenever we have this angiotensin in our blood, it's not going to be able to bind to those receptors and produce these effects, which is gonna do the totally opposite of those effects. So let's talk about those effects when this ARB medication blocks the receptor and doesn't let angiotensin 2 produce its effect. Okay, we'll talk into the second slide. So let's say we are blocking this angiotensin 2 by ARBs. So one of the angiotensin 2 effect is it increases sympathetic nervous system. Now when it increases the sympathetic nervous system, it gonna cause the vasoconstriction, but when we block this, it's not really gonna increase the sympathetic nervous system. It's gonna decrease the sympathetic nervous system, and it's gonna decrease the vasoconstriction, which is gonna decrease blood pressure. That is the one reason we use this medication, to treat the high blood pressure. Second, in normal RAA system, angiotensin 2 receptor angiotensin 2 increases the sodium and water reabsorption. When we block, it's going to decrease the sodium and water reabsorption, and it's going to increase potassium reabsorption, or some people may say it's going to decrease the sodium excretion, same thing. So when it decreases the sodium and water reabsorption, it's going to decrease the blood volume, which is eventually going to decrease in blood pressure and cardiac workload. When we decrease the cardiac workload, we can use this medication in the heart failure. This is the one reason we use this medication for the heart failure. Now, this at the same time also increases the potassium reabsorption. When it increases the potassium reabsorption, it can increase the potassium level in our body. We need to keep this in mind, and this will help us to understand what the side effects of this medication is gonna have. Now, it also gonna decrease the ADH secretion from pituitary gland. Now, when it decreases the ADH secretion, which is antidiuretic hormone, it's gonna increase water excretion in kidneys, and when it increases the water excretion, it's gonna decrease the blood volume, and which is, we can refer it back that it's gonna do what? Decrease in the blood pressure and cardiac workload. So there are many different ways it decreases the blood pressure and cardiac workload. That's why we are using this medication to treat the high blood pressure, and also it's helpful in heart failure as well. So since we understood the mechanism of action and why we use this medication in heart failure and high blood pressure, let's go over the side effects and what are the nursing consideration. As a nurse, we have to look for and also educate the patient about. All right. So obviously the first side effects, it's going to be the hypotension. So this medication can decrease the blood pressure significantly, because remember, angiotensin 2 is a potent vasoconstrictor, and when you block the effect of angiotensin 2, it's going to it's going to prevent vasoconstriction, and it's going to decrease the blood pressure significantly. So what are the symptoms you see if a patient is hypotensive? Dizziness, lightheadedness, faintness upon rising. So you want to look for this symptoms when you give especially the first dose of the medication. You want to assess the blood pressure before giving the first dose and monitor after regularly, in order to make sure the patient doesn't get really hypotensive, because if they get hypotensive and if they try to get up due to the dizziness and faintness, they can fall. So that's one of the precaution and teaching we have to do as a nurses to patient. Now let's go back to this previous slide really quickly and looked at this potassium reabsorption, okay? And we talked about this can increase the potassium level. So that's why one of the side effects, it's gonna increase it can cause the high potassium level in our body. So what are the symptoms for high potassium level? Confusion, numbness or tingling in hands, feet, cardiac arrhythmia. So we have to look for those symptoms and have to teach to the patient about those signs and symptoms as well. Now, since it can increase the potassium level in our body, it is contraindicated in the potassium sparing diuretic and salt substitute, because the potassium sparing diuretic is going to increase the potassium level as well. And salt substitute contains potassium. So that's why you don't really want to give two medication or any kind of supplements with this medication, which is gonna increase the potassium as well. So if you give it, the potassium can go up really to a lethal level, like a normal potassium level, if you say 3.5 to 5.2, and it can be different from different hospitals since they all use different instruments and everything. So but normally it would go above this 5.2. Now, since this medication is going to prevent the blood flow to the kidney by decreasing the blood pressure and by decreasing the blood volume, you want to really monitor the BUN and creatinine in order to assess kidney function. And you want to do these labs periodically, so we can monitor kidney function over time. And obviously this medication is contraindicated in the liver damage, because most of our medications get metabolized by the liver And if the liver is damaged, this medication can accumulate to the toxic level and can cause more side effects, and also for the renal disease as well. Now, how do you find out which drug is ARBs? So let's go over some examples. Losartan, valsartan. So if you see this medication at the very end, all drugs ends with sartan. So any drug that ends with the sartan is ARBs, which is angiotensin receptor blockers. So drug that ends with sartan, ARBs. Alright, this is all about the ARBs. If you have any questions, you can email us or contact us. Thanks for watching.